Welcome to the Recovery.com podcast. Today, we're thrilled to welcome two distinguished guests. First up, Dr. Sarah Boss, a clinical director and lead psychiatrist specializing in addiction and eating disorders, known for her innovative work with neuromodulation techniques. Alongside her is Gita Chaudhuri, clinical psychologist and director of psychotherapy at The Balance, who brings a holistic approach to mental wellness, integrating systematic therapy, psychoanalysis, and mindfulness. Both were speakers at the 2024 Oxford Masters Series. I'm so excited for us to dive into this conversation. Welcome.
Thank you. Thank you, Dr. Mala, for having us.
Of course.
Thank you, and so nice to meet you.
So nice to meet you. So I'd love to dive into journeys first. What was your journey into this field and into this arena, and what motivated you to specialize in your respective areas?
You want to start, Sarah?
Okay, I can start then. Yeah, I'm originally Austrian, and I did my medical training to become a psychiatrist in Vienna. And there it takes quite a while. So you really have to be motivated to go down that journey. And I really always wanted to become a psychiatrist. So I did that 16 years training. And I also became a psychotherapist there, did trainings in many methods. In Vienna, that's easy as it's like the city of psychotherapy. And afterwards, I went to Switzerland and I got trained in neuromodulation techniques, which seemed very interesting for me to try to have other methods apart from talk therapy and also using so much medication as the world is doing still. So I got into neurofeedback and TMS, TDCS, these kind of modern methods we have, and then also became a therapist for orthomolecular medicine or functional medicine, which is also quite interesting. I found to take into account, for example, the microbiome, the brain-gut axis, micronutrient deficiencies we might have, the whole biochemistry behind the scenes, so to say. I always try to not see one part of us or just the brain or just emotions or just the biochemistry, for example. But all this was still not fulfilling, or it was always in many rarely complex patients. I found that there was something missing still. And that's when I started to get more and more into these so-called bottom-up approaches and did the training for somatic experiencing. That already when I was living here in Mallorca, and I did that training in Barcelona, and that was what was still missing. So these 5 areas that I got trained, each one of them was a part of my journey, so to say, a journey to try to find out how to best help and how to really understand what is going on with somebody. And I really think that all of them are needed, and I wish all practitioners would have the opportunity, time, and resources to have those trainings. I understand that's very hard, but in my opinion, I wouldn't be satisfied to only have 1 or 2 of them now, for example, as a psychiatrist, because each one of them is just important to at least have basic knowledge, I would say. So that's a bit my summary.
Love it. Love it. Geeta, how about you?
Yeah, if you want to know my journey, why I became a psychologist, maybe that starts even in my childhood, because I come from a background with a lot of trauma. Both my parents experienced trauma in their lives, and there was a lot of pain. As a child, I was very curious and interested in human beings and why they feel in a certain way and what they're going through and life and all these kind of things. And I started to read books about psychology already by the age of 10 or something. My first book I read, Freud's Studies of History. I was 10, I think.
Yeah.
Yeah, and maybe also a little bit as a coping strategy to understand what was going on with my parents and in my family. And so my interest in psychology and mental health is not just academic, it's also very personal and intuitive. And also with my Indian roots, I think I'm having a very scientific approach, but at the same time, I'm coming from a very spiritual background at the same time. That was always also interested in, it cannot just be that we treat emotional issues just with scientific approaches. in the course of my career, I was always interested also in related science, areas of related to sciences like alternative healing methods or mindfulness, meditation, all these kind of things.
Yeah.
And I also felt we can only go through processes of a real change or profound transformation if we integrate all those levels that humans are facing, the physical, the social, families, emotional, internal, external. I started with psychoanalysis, but felt then that is to one side. It is also a very cognitive and analytical approach. The body is like almost completely excluded, actually. It's just talking, and even talking without looking at each other. There's also no attachment going on. I find that very upsetting in my own psychoanalysis that I had to go through. So from there, I was already looking for different approaches, and I got a training in systemic therapy, and I learned it was so fascinating for me, also with all the philosophical and theoretical background of the systemic therapy. But still, the body was still not very good. I used to be a dancer also when I was young. I was a dancer. So I felt always, for me to heal, it was important to dance, to move my body, to do yoga, to do horseback riding. And I realized in my own personal growth and journey that talking is not enough and that we have to experience something. So that was my approach, experiencing rather than working through things, right? Yeah, so then I started to do hypnotherapy. They are working a little bit more with imaginations and so on. And then I found like more and more it became a thing to integrate mindfulness and also to use the body. And then, of course, when I met Sarah, that was so great because we are very similar in our academic and professional development. And we both were like, yes, exactly. We need to include the body more. Yes, we need to do this and this. So we developed this integrated approach for the balance and also in our own private practices. And it's great to work with a team where we have all those different therapists who are coming from different angles and can focus on maybe just tensions in the body, or because we need to connect with our body in order to feel whole. And also, so I did some trainings in some different kinds of methods and approaches, and in the course of the time, I just built this integrative thing. I don't know if it even has a name. It's just our way to work, if that makes any sense.
No, I love hearing that. And this is my question, but I'm going to preface it. Did you feel as you were building your programming that there was resistance originally, like when you first started doing it, or was the development of your integrative approaches more recent? The reason I ask, and here's the background, is because when I first started in the field, boots on the ground, doing clinical work, doing program development, I have similar background, and there was definite historical trauma. I myself experienced trauma, and that motivated me to be very integrative with my program development because I too found the benefits of combining therapeutic, clinical, evidence-based approaches with what at the time was not evidence-based or researched, like with things like movement and dance and yoga and art. It's just so cathartic. But I was met with a lot of resistance in those initial stages of program development, because we're talking like 20 some years ago. So I'm curious to know, like, what have the resistances been, if any, and how have you overcome them? And then do you find that there are still stigmas that create kind of a barrier to utilizing integrative approaches?
Not anymore so much, I must say. Of course, you end up very easily in this kind of holistic, esoteric kind of woo thing, but we are also both thinking very scientifically, and we also appreciate evidence-based techniques and so on. So we are not, unless we completely rebel against anything that is scientific, not at all. I think that's the idea of integration. But so here in Mallorca, actually, I don't think we have this problem, and I think we can say we are well respected in the field right now. But I started maybe even earlier than you did. It's like maybe 30 years ago, and it's with the psychoanalysis. They would really like, what systemic therapy, what therapy? Okay, so now you're leaving the real therapy field and you're doing some crazy stuff. But I always was some kind of rebel in that sense, and I liked it. I like this.
Yeah, me
Have
too.
this kind of resistance.
I love doing that too, like just going against the grain. Yeah.
And the good thing is also that nowadays we can explain it well. For
Yeah.
example, with polyvagal theory of Dr. Portes and with our background, I think it makes it easier, like we also do with our clients always. We're
Sure.
really transparent. We like to explain a lot so that they feel safe and that they understand why something makes sense, why it makes sense that they're being touched, that it's not just a massage like in a hotel, why everything makes sense and what it's doing to the physiology, to the body, to the mind, to the emotions, to body memories, all these kind of things. So I really usually start with explaining that even before they come, and then they're more open to it, and also our colleagues. But I must say, in Spain, the psychiatric colleagues or medical doctors in general, they're not open yet.
No.
They're not there yet. But that's that will take a.
But
That
I
will
think
take
that's
some
just
more.
knowledge.
Yes.
And once you are in the system, so we both have this privilege to work very freely, and also with the balance, we had a lot of space to develop our own ideas, and that is really a privilege. I think we
Yes.
weren't working in a public hospital or something where you just have to follow the protocol. I think we both never really fitted in such an environment. And that is why we do what we do. And what you just mentioned, Sarah, like explaining things, I think that is one of our crucial aspects in our approach, that we have 100% transparency about what we do with our clients and why and when and what for. And also it's that because we believe in autonomy and the collaboration, the cooperation between client and therapist, and there's no hierarchy. For example, I was just now in India and go for an Ayurveda retreat. And I completely trusted the process and had all kind of treatments, but I never had a clue why and what they are doing.
Yeah.
And I kept asking, so what is this good for? In the end, I put all the names on ChatGPT just to get some ideas of what is it. And yeah, here is your medicine, ma'am. Yeah, good. Okay, what kind of medicine is that? What is it doing to me? And I believe really, if you as a patient or a client, if you understand why you are using this kind of technique or why you're taking this kind of medicine or whatever, if you understand it, it has more effect because your mindset or your brain, your nervous system is also manifesting it in a way. It's
Absolutely.
wiring that direction rather than you being very super clueless, not knowing what's going on, passively submitted to the process. Then you lose all your access to your own resource and your self-healing powers, right?
Absolutely. Yeah.
Yeah, you hit on it. I'd love to hear for our audience, especially those who are patients or maybe loved ones who are encouraging their loved ones to go into treatment, that concept of just surrendering and trusting the process. What tips and advice do you have? Because that can be challenging for a lot of people.
Yeah, surrendering and the trust. We build trust by understanding and knowing things. Like this, we build trust. So it's easier for people to trust and surrender into the process if they feel respected and if they feel their self-efficacy in the process. And we foster the self-efficacy, the sense of self-management. Actually, we don't call ourselves healers. We don't like the word healing at all, actually, because we don't think we do that. People heal themselves, and we just show them a little bit how they reconnect with these resources, right? So I think in order to surrender to a process, you need to have some kind of agency.
Yeah. Yeah.
And feel like you connect to another human beings, or in our treatment center to many other human beings that they can also co-regulate you. That's so important. We don't speak about that enough. I think in therapy or also with the medical doctors, they should be regulated themselves. And then it's easy to trust the process. And that unconsciously, we're not even aware of it, but we feel safe with somebody or not. And we feel like we can trust somebody or not. We experience it.
So that's about the being regulated as a therapist or as a practitioner, right? Not like stress and in a hurry, in a rush. And also that is about attachment, what you just mentioned there. If you just look at your screen and talk to your patient and at the same time typing some data in, there is a total lack of attunement and attachment. So how can you ever feel safe and connected and trustful, right? So we really focus also at first so that our clients and patients feel safe, we focus on the relationship, and build a safe space for our clients so that they can relax. And then also nervous system wise, they relax and then they can surrender. And then it's like horseback riding, actually. Then there's no tension and you do the process together. And no one has to pull and squeeze and whatever. It's just like
Naturally.
yeah. The process of stabilization actually is the most important one. Creating the safe space and the confidence and trust and faith in the process.
Absolutely. So for patients, important to look for that element of stabilization in treatment programs. And certainly that's what you reinforce at the balance and of course privately. And that's really good. Let's dive into a little bit more about eating disorders. What research are you doing? What have you found? What's happening right now in our world of eating disorders?
Yeah. So my experience, it's still a very gray zone field. Many therapists don't really want to work in this field. And there's a lot of helplessness also in practitioners and therapists, which may be very similar to the situation in the addiction field earlier. Maybe there has been more progress in the masses, but eating disorder has been underestimated for such a long time. And people didn't really know also, is it an addiction or is it an adaptation disorder or what is it, right? I think we cannot really understand what eating disorders are if we just look at the symptoms. We have to look at the family dynamics, at the person, at the attachments, and all these kind of things. And then we get an understanding. And I think if we look at the literature, it's really difficult to find good books or good approaches. It's either like we have to do force feeding and a lot of controlling and a lot of monitoring. So that's just to focus on the symptoms. Or it's we have to work with the mother, but it's also very one-sided because it's a combination. There is a physical threat, there is a neurobiology, there is dynamic, there is social influences through social media and so on. This perfectionism of having the perfect body. There's so many layers of factors and influences. So without having an integrative approach, it's almost impossible to achieve any changes or
Dr. Boss, I'd love to hear your thoughts as well.
Yes, I can just add to the same that it's like in trauma therapy, like we said earlier, we have to absolutely work with the nervous system. It's such a threat to the body and to the mind, to everything. Our clients, or most of them, they're starving. It's like it's a vital threat and they're in a constant survival threat. So we have to see it as a major state of being that they usually have been in for years already. And that we also have to work with the body, absolutely, with all those bottom-up approaches that we include. They're so important with regulating in themselves again, with trusting, with starting to sense again their body. They train themselves to not even feel hunger anymore. Everything is out of balance, out of regulation, from the hormones to their everyday life. It's such an impactful disorder, I would say, like almost no other. So it's very complex.
Very complex, very serious. And I think that is also what brings the therapists and practitioners and clinicians in this emergency state because it's so threatening and so spectacular sometimes that then suddenly you act out and you want to force feed and all these kind of things. And it's so important that we as therapists stay regulated and that we broadcast safety and security and we know what we're doing. And that is also sometimes the dynamic in the family because there's a lot of helplessness and a lot of fear regarding the symptomatology. And we have to validate that, but we also have to reframe the whole process so that they understand and that they can relax. And also here, I think we foster autonomy instead of taking away their autonomy and starting to control them because that will just activate more of this restriction and this self-controlling that we always see in eating disorders.
Right.
So it's complex. And your question was a little bit, how do we see the field, right? Or how do we see what's going on outside? So That is also why it was so important for us to bring it to a conference like in Oxford to talk with other people, where we saw we have all the same approach, but no one ever applied it on eating disorders. That we talk about trauma, we talk about addiction, but we were the only ones who spoke about eating disorders, actually. And we were surprised because it's very common, and so many, also more and more boys, not just girls, also older, like women and young men, and then all this over healthy eating and over exercising and all these kind of things also part of eating disorders, all this belong to this area of disconnecting completely from yourself and trying to achieve something with a lot of restriction or self-control.
Yeah. How do you integrate different types of therapies into eating disorder treatment and trauma treatment? What are some of your favorite, Dr. Boss? I know you've got some techniques and methods you like to lean in on. Can you walk us through some of those today?
Yes, of course. It's in general, it's really important that we work closely together as a team, because Gita said it can be so easily overwhelming. For example, for the nutritionist that has a difficult role, the clients might start negotiating, and it's very difficult. Or also the general practitioner that is very worried the patient is losing weight, and we have to do something about that. She needs infusions now. And like Gita said, easily we get into an alarm mode. So we want to work really closely together, and most important, again, stay regulated, because we have to transmit safety and regulation at all times, because that's exactly what they need most. And that's why we want to use a lot of bottom-up approaches. We do somatic experience, which is in the beginning very difficult because they're very disconnected and their body's even threatening for them. And so they would really carefully start noticing sensations in their body again through yoga, also, for example, postures, which is much easier in the beginning than just sitting there and being asked to check what's going on inside of you. So we would do movements. We have, for example, Qigong in the garden. Yeah, I love nature. I think it's one of the most important resources we also have here, because Mallorca is so beautiful. So we do a lot outside. We do meditations. We do walks, nature
Craft
walks.
work, like Sadamis, with the hands, working with the hands.
Yeah,
in a
art
sense.
therapy, music
Equine
therapy,
therapy.
equine therapy, exactly. And also we do a lot with touch after we explain them why this is important and what should happen, and sound healing. I also always explain them in the beginning already a little bit how the polyvagal theory works. What is vagus stimulation? Why is that important? What's the goal in the end? That they feel safe, that they can trust themselves, the process, that they can get better, that they can achieve what they want to, what they came for. And then it's really surprisingly open, and that's really beautiful to see, to also give all the treatments a chance and really enjoy them also. We see that.
And also what I would really like to add here is that, again, what I said, we need to provide a secure attachment. And that takes a long time sometimes, because most of the clients that come to us with eating disorders have gone through a certain process already, being admitted to hospitals, having been force-fed, being traumatized by therapists and their own family, because everyone was all the time dysregulated. And so they experienced a lot of controlling, and they're many times very confused. So what our approach is, in the beginning, we don't want to change you, or we don't want to force you to change anything. We first get in touch with you. We build up this relationship. We want to understand you. That is what we call pacing. And only after the pacing is really established and we know where the client is and what they need, from there we can start with the leading and guiding, if that makes any sense. So we're not just telling them what to do in the first place.
Right.
We listen what they need and where they are and what their situation is. We reparent actually by building and establishing a good relationship, a bonding. And there we co-regulate. Then we use all these methods and techniques and therapeutic approaches coming from all kind of angles: physical, emotional, mental, spiritual, mindfulness, mindful eating, mindful noticing, mindful walking, all these kind of things. Being very present instead of, oh God, what will they say, or how will that be, or why was that?
Yeah.
Because we also see that usually these clients are very intelligent and very analytical, and they're very cognitive. And also, if they have very low weight, psychotherapy can also be very difficult or even impossible. So it's a beautiful way, and sometimes surprising way to them, to start with the focus more on these approaches, and carefully and slowly increase the intensity also of other sessions.
What is your thought about integrating humor into healing? And have you had any experience with that? Yeah.
Absolutely.
So-
I
so
couldn't
important.
imagine. I couldn't
Yeah.
imagine a life without humor. Yeah, absolutely.
Yeah.
So important. It's such an icebreaker, and it's a bonding thing,
Yeah.
and it takes all the heaviness out. I laugh a lot with my clients,
Yes.
and we as therapists, we also laugh a lot together.
Yes, absolutely.
Important. Oh my goodness. Yeah. We need to be able to, as providers, have that community and ability to debrief with one another,
Yeah.
both with the serious and with the humorous. So that's great to hear. Wonderful. So, co-occurring disorders, we know that eating disorders, addictions, they run comorbidly with other disorders. How do you address complex comorbidities, and what do you suggest for individuals who are feeling more than one symptom and not knowing what to do?
Actually, we don't work with those categories of the diagnostical manuals. We just see, okay, there are symptoms and there are underlying issues, and the symptoms have a function. They are originally there as coping strategies, dysfunctional or parafunctional coping strategies. Many symptoms have been developed in order to protect vulnerable parts. So we work a lot with this IFS, the concept of having different parts, the inner family system, right? There's an eating disorder side, there is a very vulnerable child, there is a protector, there's a radicalized protector, and all these kind of things. That makes a lot of sense. So we don't use the word comorbidity or so, but we see it rather in layers. So there is a symptom, and there's another layer. The symptom is representing some need, and behind that need that maybe have been frustrated, never been met, there is an attachment impairment or the disruption or a neurobiological disruption due to early attachment trauma, and so on. Because there is no addiction and no eating disorder actually without any traumatic background, without any attachment impairment. So we don't see it as comorbidity.
So, for our listeners and people who may not understand where to start, what do you recommend? How should they get started in the journey? Because that's daunting, that's scary. They're feeling so many different things. They don't know what's going on or why this issue has perpetuated, whatever the issue might be. So, how do you start? What do you recommend?
That's a good question. I would, of course, recommend to start with a good therapist. But the question is, where do you find a good therapist? So that also depends, of course, where you are. But not just that, with anything, but that's already the topic of what does recovery in general mean. But it means they can find a group, or there are beautiful mindfulness groups, for example, with these MBSR trainings. They can do yoga groups. They can start to explore a bit this whole field, also around psychology, not just finding a therapist.
Yeah.
And then and read books, read good books about it. That's also very helpful. And each book leads you somewhere to explore further, maybe go into more so for example, somatic experiencing way, which is not a psychotherapy, but it's also a way of exploring, of going further.
But I also think many people don't have access to a high qualified therapist. And of course, also the balance. It's a very expensive program, and we are aware of this. So people who come in this kind of treatment are privileged. But I really think it's so important for people who have real serious problems that they don't stay alone with it, that they reach out, that they are looking for groups, self-help groups, that they get out of their isolation. I think that is so important. And I remember when I was very young and I had my personal struggles, I was trying the psychoanalysis in the context of my trainings and so on. And I talked to my boss by then, who was also a psychoanalyst, and said, "This therapy is not working for me. It's just not working. I can talk in a more beneficial way with my boyfriend." And he said, "Then talk with your boyfriend." And that was so relieving for me. I said,
Yeah.
"Oh, thank you. Yes, I
Yeah.
don't
Yeah.
talk to a therapist anymore." But it's important that we talk to someone and that we don't stay alone, and that we find people who have this, maybe the same issues or similar problems, and then we share. Sharing is so important.
Yeah.
And nowadays, I cannot underline that more, because nowadays people tend to stay inside and they just connect virtually and they think that is friendship. But I think the personal kind of face-to-face contact and connection is crucial. Doesn't have to be a therapist.
Mhm.
Yeah.
Absolutely. In that book, I absolutely recommend The Anxious Generation, where he also emphasizes how important community is,
Yeah.
which got completely lost throughout the last years.
Mhm.
And community can be anything. It used to be maybe church or some kind of religion, but it can be anything from joining an NGO or collecting trash from the beach or whatever it is. Anything is useful, or singing in a choir,
Yeah.
just being a part of it. We're social
We
beings.
need to belong. We need our
Exactly.
tribe.
Yes.
And that is actually the big achievement of the AA program, right? In addiction, they built this fellowship, they built a program where people can meet and where they can open up. And we lack those things for eating disorders. Of course, there's a lot of shame still going on. And especially with the eating disorders, they don't want to talk about it because they feel like something will be taken away from them. So the complexity is even more profound sometimes than with addiction, but they need this sense of community, and I'm not alone with this, and I don't have to feel so ashamed. There are others who go through the same process, right? Yeah. And that is something, of course, find a good therapist, yes, of course, but in
Yeah, that's not
reality,
that easy. No, we
Yeah.
know that. We've been through it as well. I
Yeah.
had so many.
Yeah. So, I mean, on that note, also, what would you recommend in terms of the steps of finding a therapist that works for you? Because it is a daunting process. Everybody is not for everybody. You got to find your match. What are your suggestions there?
There's always these lists online in every country, depends on where you are, or maybe you get referrals. But if possible, I would always try to find a therapist that has deeper training, that is also a psychotherapist, not just a psychiatrist or psychologist, and most of all also has trauma experience and bottom up approaches if possible, or at least open to it.
Yeah.
And it's constant. We are always continuously in trainings. We're always open to the newest. So I would really try to find somebody like that. And also what's really important, I always tell the clients that it's completely normal that maybe to try to meet three or more if needed. And if they don't feel comfortable or safe with someone, they shouldn't push through it. That's really not what it's about. It used to be that we thought that maybe something's wrong with me if I don't feel comfortable. And so if after a while they feel like that's not a good match, like you said, maybe they want to try somebody else. And there's so many options out there.
Yeah, it's really important that the therapist has some integrative approach and that they are not trained in just one method or technique. I think that's very important. As you said, it has to be there has to be a personal bond. And I always encourage people to use their intuition also. Do I feel it? How does this feel? Do I feel heard? Do I feel acknowledged? I would really encourage people to listen to their gut feeling when they look for a therapist.
Great tips. Great tips. All right. So the last question that we land on is, what does recovery mean to you?
We mentioned many of those things already. In the end, I would say it's to live what you experience. For example, here at our program, to keep on living that. It's like a change of your life somehow, meaning that you might have different lifestyles. You might take better care of you. For example, your nutrition, how you exercise, what you need to never stop listening and being connected again to your needs. and to your body, how much fresh air you might need, or how you feel with somebody. Set boundaries, not start ignoring them again and feeling overruled by whatever life might pressure on you. So really to live those things and change life, and most of all, change the way you treat yourself, that in a more caring, loving way, and that forever, because it's not something that will ever go away.
Yeah, I mean, that said, I think recovery is a process. It's never really ending. It's not a thing that has a beginning and an end. And it's a process of finding balance and reconnecting with resources, finding resilience. And it's more than just getting rid of symptoms or being symptom free. Or my recovery as an addict is not using drugs anymore. For me, recovery is way more, as you said. It's a change of lifestyle. It's personal growth. It's transformation. It's a transformative process, actually. It has to be sustainable, right? This is why I think people, I don't know if I would say I am in recovery. Maybe that would not be the right word, but I'm always in this process of growing and developing better self-care, all these kind of things. And I think we all are in this kind of process.
100%. Yeah, I love it. I am so thankful to you both for spending time with me today. How can people reach out to you if they want to find you?
With the Balance website,
Yeah.
for example, there is phone numbers, and depending on the countries.
We both have websites also. So they find us with our names, like typing our names in Mallorca. It's easy to find us. We are not having any secret personalities. We are very accessible. So we're on LinkedIn with Balance, of course.
Right.
And there's a great team for client relations. And they will lead the people through the process.
Thank you so much. It was such a pleasure to have you. Thank you for tuning in to today's episode of the Recovery.com podcast. For additional information, resources, and to access treatment options, please visit our website at Recovery.com. We appreciate your listenership and are excited to have you join us on our next show coming soon.